Today we're going to talk about umbilical vein cannulation. Too easy to get? Just as easy to forget. Remember, this is the best line at birth. You can use it up to 7 days, but realistically, the earlier you use it, the easier it'll be. The first thing you'll need to do is clean the area. Chlorhexidine, betadine, and a sterile drape. Then loosely tie the base with umbilical tape. You will need to cannulate the vein, so don't make it harder on yourself than it needs to be. Now cut 2 centimeters above the base. It's got to be a clean cut in order for this to be working as efficiently as possible. And also remember that you're going to cut this 2 centimeters above the base. So when you're the person who's clamping the cord, when the baby is born, leave yourself some room, just in case. Now grab it with a clamp because you're going to need to cannulate it next. You may need a little bit of traction here. The umbilical arteries and the vein basically look like 2 eyes and a mouth. The eyes are very thick and muscular, and there's 2 of them, and they match each other. That thick muscular layer is palpable, so you should be able to tell the difference. The mouth is going to be a little more relaxed, without a twin, and as you see in the lower picture, often upside down to your view. Use a catheter. It should go in easy. Again, you may need a little traction. Blood return will confirm that you're in the right place, but do not go further than 4 to 5 centimeters because that could lead to complications. Aspirate, then flush with sterile saline. Now you're in. Tie the umbilical tape to hold the cannulation tightly and securely where it needs to be. Again, don't forget, no more than 4 to 5 centimeters. Totally slowly roll. A lot of times people get in something, as soon as they intubate something, they want to shove the tube as far as they can because they're in, and they want to be sure they're in all the way. In this case, going too deep would be a big problem. Portal cannulation can cause complications, and the portal circulation is very close to the umbilical vein as you see in the picture. Blood should be withdrawn to be sure that you're in the vein. Absolutely do not bury it, only 4 to 5 centimeters. If you don't, it could lead to perforation, hepatic vein clots, or hepatic necrosis, none of which you want in your newborns. Now tie the umbilical tape for security. You can use this H tape for more security, holding the tube in and securing it to the abdominal wall and not under any traction, which could cause problems. Ultimately, you apply a sterile dressing, and you're done. Thanks for listening.